Mr. Alwin Alias, who is an academician and an RCI registered clinical psychologist, focuses on research in psychotherapy on intersectionality and minority well-being. Currently, he is pursuing his PhD in clinical psychology at the National Institute of Mental Health and Neurosciences, NIMHANS, Bengaluru. He's expanding his expertise to geriatric sexuality and intersectional geropsychology. As a research scientist in an ICMR funded project on older adults, his work focuses on testing efficacy of trans-diagnostic cognitive behavior therapy. He has earned an MPhil in clinical psychology first class from NIMHANS, gaining expertise in diverse psychotherapies and research, and an MSc applied psychology from the University of Kerala, India. Formerly a UGC NET qualified assistant professor at the Montfort College, Bengaluru. He has taught psychopathology, clinical assessments, and group counseling. Community engagement is crucial to his identity, reflected in his role as a resource person on intersectionality and sexuality in state and central academic institutions. He embraces intersectionality of his identity and firmly believes in socio-political significance of mental health. I'm happy to introduce the next resource person for the day, Ms. Deepthi Bisoi, to everyone present here. Her academic qualifications: she has completed her MPhil in clinical psychology from NIMHANS. She has an MSc from National Forensic Sciences University. Her work experience: she has 3 years of experience. Previously worked as a clinical psychologist in the Department of Clinical Psychology in NIMHANS, dealing with children and adolescent mental health. Her thesis has been in MPhil has been on how to deal with adolescents with dissociative disorders. Currently a first-year PhD scholar in clinical psychology and working as a research scientist in an ICMR project on trans-diagnostic cognitive behavior therapy with older adults. Some of her interests are understand how psychotherapy processes work, psychotherapy with older adults, children, and adolescents. And with that very, very short introduction, I would like to hand over the session to Mr. Alwin. And a very, very warm welcome to you, sir. And the floor is yours. Over to you, sir. Thank you so much once again.
Thank you, Anita. Thank you for the warm welcome. So I'll share my slides right now.
It's visible, sir. It's visible.
It's visible, right? Okay, thank you so much. Yeah. So as mentioned, we'll be talking about cognitive behavior therapy specific to older adults, like how this behavioral intervention works for people who are older adults. So I'll begin it with introduction to cognitive behavior therapy. So the session is divided into 2 parts. So I'll be talking about the cognitive behavioral therapy, an introduction. What is cognitive behavior therapy, how it emerged, and what are the major common mental health concerns for people who are older adults. And the second part will be basically on how this cognitive behavior therapy will be implied on people who are older adults. So that will be dealt with Ms. Deepthi. So I'll just finish. It will be maximum of 15 minutes per session. And then later, after Deepthi sessions also, we will have the discussions regarding this topic and where we will take up the questions and then understand more about CBT principles as well. So moving to basics. So here in the slides, you can see that, like I have put it mentioned as this, the common mental health concerns in older adults, influencing factors. So we know that mental health don't have a discrimination of the age, like people from any category across their lifespans can experience mental health concerns as they have mental well-being as well. So there are a few major concerns that we encounter when people who are from the older adults come for therapy. So basically from depression, anxiety, somatic pain, sleep issues, etc. So depression, we might all use that word very often in our daily conversations, or maybe through you have read across in the newspapers and articles. So depression, let me specific it like how it means to be. So a person with depression, they may experience low mood throughout a day. Like they don't feel like doing things. They feel extremely sad. It is different from sadness that we experience. And how the manifestation comes is that they will feel really low and they don't feel interest in doing things that they used to like before. At least these two major things will be there. Then gradually when it increases, there will be symptoms of death wishes that they don't feel like living. Like they will question like, why should I live ahead? My life don't have any meaning anymore. So these kind of questions will come, and their sleep, appetite, everything will be disturbed as well. Next comes to anxiety. In anxiety, what happens is that there is like we all use the word like worry. I'm worried so much right now. So this becomes a diagnosis like everyone will have an amount of worry, tension, etc. But when it starts to make the person dysfunctional or when it's crossed the limit, then we call it as anxiety disorder, where the person is not able to do their daily activities or the person is not able to function in their office because they're for anxiety. Like I'll talk about more about like what happens in that background of anxiety later. Then we have encountered older adults who come with somatic pains, such as like pains in the different body parts, but there won't be a biological cause for it. And when the MRI and every functions are assessments are done, there is no biological cause. Then it leads to the psychological aspects of pain. Then sleep issues. Sleep issues are very common. So we have clients sometimes says that I'm worried about my future. I'm worried about my financial situation. So I can't sleep at night. So these are the common mental health concerns that people who are older adults when they come, these are the concerns that they put across. Around the circle, you can see there are some other factors which I really want to emphasize. There comes the aspect of CBT as well. So there are some social, physical, psychological, and cultural factors which plays in the manifestations of these symptoms. And we all know that like everyone undergo through stressful situation, everyone has their own difficulties, but some develop depression, some develop anxiety, some develop sleep issues. Why? Because there are a lot of other factors which plays a significant role in that. So one is their attitude towards aging. So aging is a process, right? Like when someone is going through the aging process, after the 50s or 60s, how are they accepting the changes that happens in their body, their mind, not only body and mind. There are other aspects of their functioning, like occupation. Some people get retired, some may still continue to work, and also sometimes the loss of loved ones, that is grief, it can occur. Physical health issues, again the physical health, if there is a diagnosis that happen, if there is a major physical illness which get diagnosed, there happens loss that I was previously healthy but right now I'm not able to do these physical activities. Why? Then loneliness, lack of social support. Like we have encountered older adults saying that I have a lot of issues with loneliness because I'm not able to engage with people outside. Sometimes it's a cultural difference because they may move out of their native to their children's home, and where there is a new culture, they are not able to cope up with the new culture there. And it's migration is always difficult. So sometimes they seclude themselves from the social activities and experience loneliness. Then life transitions, new living arrangements, definitely financial instabilities. So these all socio-cultural, biological, and psychological factors encounters and then results in the manifestations of the mental illness. So now we have an idea about mental illness, right? Like a very basic idea about mental illness, like depression, anxiety, worry, sleep issues, etc. We are talking about like then what exactly is happening to a person who is undergoing through these conditions. So I'll slowly take you to the initial understandings of mental health or worry or depression. So initially we had an understanding that okay, when there is a situation, when there is a stressful situation, the person will experience distress or emotional disturbances. So that was the initial understanding. Okay, if I have a breakup, then immediately I will be experiencing sadness. So we tend to forget what happens in between. So I'll read a few statements. I had an argument with my partner this morning, and I'm sure that my whole day is gone. That is a statement sometimes we might have encountered in our, in our office or in the social gatherings, that people saying that, okay, had an argument, my whole day is gone. And we also have encountered the statements like, I have to meet my doctor for a regular checkup tomorrow, but I'm anxious even now. I don't know why. So they are anxious about something that's going to happen tomorrow. That is a doctor visit. But they are saying that I'm anxious even from now, and I don't know why. So the initial understanding, okay, there is a situation that, okay, they had a fight with their partner, so that's why they are in distress. We also anticipate that, okay, they have a checkup tomorrow, that's why they are anxious till now. So what are we missing here? So this was the initial understanding. Then we understood that there is some a significant amount of thought process which we are missing out here. So what is happening in the background? So these are the two statements again I'm quoting here. I had an argument with my partner this morning. I am anticipating that I might be angry with other people also because I'm not a good person. And they will also have arguments with me. Thus, my whole day will be gone. See, when it comes out of the mouth, like I said, I had an argument with my partner this morning, so my whole day is gone. And how I come to that conclusion, because there is a lot of thought process which is happening inside me, which is making to believe that just because of one event that happened in the day will result in the whole damage of my other activities in the day. So these highlighted things that, and like, other people will be angry with me. I am not a good person. They will have angry arguments with me. Thus my whole day is gone. These thought process, there is an error in that I will discuss. Next again, I have to meet my doctor for a regular checkup tomorrow. What if there is something wrong within my body? What if the doctor asks me to get admitted? What if I get a diagnosis with something serious? What if no one is there to help me? What if the doctors couldn't find any hope in my condition? I am anxious even now. See, so from a event like, okay, tomorrow I have a checkup, I have to visit my doctor, to the feeling of anxious. See, there are a lot of thought processes that a person undergoes through. And many a times these thought processes are normal, I would say. It crosses the limit when this makes the person dysfunctional. Imagine the person who says that, like, I want to have an appointment with a doctor tomorrow, and I'm having all this kind of thought process, and I'm anxious. And because I'm anxious, I'm canceling my appointment for tomorrow. Saying that I can handle that. What if there is something wrong? So I am canceling my appointment with the doctor. I'm canceling my regular checkup with the doctor. Then there is a dysfunction. So if I have a checkup tomorrow, definitely there will be some amount of anxiety within me. But if I'm canceling the appointment because of my anxiety and I'm not able to tolerate that anxiety, then it comes a diagnosis or disorder. I hope that part is clear for everyone. And I said that, like, how a thought process, which is quite normal, can reach the limit and then result in a mental health condition. So this is a diagrammatic representation which I would like to put forward, that there might be situations and emotional reactions, and in between we have something called automatic thoughts. So some thoughts which comes to our mind without even our own interest or without the intention. I might be completely unaware. Sometimes people say that, you might have heard that, okay, there are a lot of thoughts running behind my head. There are a lot of thoughts which is going behind me. So these thoughts are called automatic thoughts. I'll give you some example. Like, I can never get anything right. Everything is always wrong with me. Imagine there is some situation that happened, like some teachers scolding a child. Take that example. The child will be like, everything is always wrong with me. My parents calls me, my teachers calls me. Everything is always wrong with me. And the person ends up in having a low mood or feeling really sad about themselves, low self-esteem, etc. So this is called automatic thoughts. So how can you identify your automatic thoughts? It's very interesting exercise if you want to do. Like, you can look for one of the recent event where you were really emotionally distressed. Then you can think about what I was really thinking about. These thoughts run so fast in your mind, and sometimes we may not pay attention. But if you reflect back, we'll be able to elicit few. And then another concept of CBT is again the cognitive distortions, or we can call it as the errors in thinking. See, someone is having some errors. Everyone has their own errors in thinking. No one is free from that. But the thing is that when it crosses the limit, when it goes beyond in person's control, then happens a dysfunction. So in the right side, you can see I have kept some examples. So one is that if I don't get care and attention from my children all the time, then they don't love me. If I don't get care and attention from my children all the time, then they don't love me. This is called something called all or none thinking. Like, my children should always love me, and if there is any kind of emotional disturbances that comes from them, which means that they don't love me. And we know that the reality is not like that. We are humans with a lot of flexibility, but we are not able to. If when we have this cognitive distortion, we won't be able to distract our cognition from that, which is distract our thinking from that. So then what happens? I'll be stuck in that loop. Oh, they didn't like me. That's why they did behave like this to me. and we forget all the past beautiful experience we had with that person. So that is called like all or nothing, like either this or nothing. And there is something called because of me, all the bad things are happening in the family. People may tend to have this personalization, like we know that one thing's happened in the family because of a lot of reasons, but we don't believe in ourselves, or we don't have enough self-esteem, and we may think that okay, it's because of me that everything is happening and I'm stuck in that, and this will result in my other activities of life, and I won't be able to function well, and that happens in the low mood, or I feel that I'm not worthy enough, etc. Again, another one, if this relationship doesn't work out, I will never find the right person. Lot of putting a pressure on a person. Again, it's catastrophization, like, or conditioning, I would say that. Now we understood there are some automatic thoughts which happens behind us. It happens for everyone. No one is free from that. Everyone listening, talking, including me. I also have my own automatic thoughts running behind. I also have my own cognitive distortions or errors in the thinking. Again, I will have my own rules and assumptions in life. Like those forms from my early childhood, like with my interaction with my family members and my people around me, my situations, etc. Like, people sometimes say that I should be good in everything. I should be the best. I should be the first one. And we also keep some conditions also. If I cry, I am weak. Right. So having a lot of conditions like this, which we cannot rationally evaluate, put us in, I would say that in quotes, trouble with mental health. So when we have a lot of rules and assumptions that keeps us or can pulls us back from having a well-being, we can call it as rules and assumptions. So these are like conditions. The two examples is very common with us. Sometimes we all have it. Like if I cry in front of others, then I'm a weak person. And also sometimes say that I should be always best. I should be the first one. And imagine a person may have to step back at one point of time in their life. They will feel really difficult to move on. So these all are the things which comes in the background. And the another important point is about the core belief. Everyone has their own core beliefs. Like listen, me and everyone has their own core beliefs. As the term indicate, it is a very deep level of beliefs that a person has, which we develop in our early life. It's about ourselves. It's about others. It's about the world. Like I have kept few examples here. You can see that. One is that I am worthless. It is about me. Like I have a very strong belief that I am worthless because all my life experience have taught me that I am worthless, or I am not able to see other part of my life, or I am always focusing on the negative aspects. And from my childhood itself, I have this thing that I am worthless, and that's very strong inside me. Sometimes I may have like I am lovable because I have received a lot of care and love and affection, and I was able to reflect on that, and I feel that okay, I am lovable. That is a positive core belief, if you want to call like that. And then sometimes people say that this world is really unsafe. That is again a core belief. So people with social anxiety may have a lot of core belief like the world is unsafe. People with depression have a core belief like I am worthless. See, these are the fundamental things where can come up in a person's core beliefs, which can result in the mental health concerns. For all these things which you mentioned, rules, assumptions, cognitive distortions, core beliefs, everything can result in a mental health conditions. And we have a therapy approach for that, which is basically a talk therapy. That is called CBT, cognitive behavioral therapy. I'll just briefly tell you what the history was. So it was introduced by Aaron T. Beck. The person who's standing with the pigeon is not Aaron T. Beck, that is B.F. Skinner, who was the initial person in behavioral modifications. Or everyone have their own behavior, right? Like some people, while listening right itself, like you can know that, like if someone comes into the room, the way you behave will be entirely different from the another person in the another ID. So the people you react to the stimuluses are entirely different. So that's the person B.F. Skinner was speaking about. And we have Aaron T. Beck, who can be called as a founder of CBT, where they realized that, okay, you can identify the cognition, the thought process of a person and their emotions. And then we can modify both of these, of any of these, and then result in the person's mental health. So that's how in early 1970s, we started CBT. And now we have more advanced versions of CBT, which integrated with a lot of things like mindfulness, etc. So far that we were, hello? Yeah, so yeah. Yeah, so
Sir, you can continue. I'll just mute them, sir.
yeah, hi. So this is a model that is proposed by R&T Beck, but this is integrated to a case history of an adolescent. But you can see, I will just take you very briefly here. You can see that everyone will have their own early experience, like growing up in a family with conflict, separation, family health issues, etc. They can develop an assumptions like this is a case of an adolescent. So that assumption was that if you disagree with someone or fall out with them, then the relationship is over. Like if I have a disagreement with my parents, then the relationship is over. That is the assumption that I developed. The core belief comes that if people fall out of me or if people leave out of the relationship, then I will be alone. And this, I'm growing up with these assumptions and core belief in my head, and I had a critical incident where I'm being bullied by people or I am losing contact with my long lasting friends. Then my negative automatic thoughts get triggered, like no one likes me, I will be always alone, the world is a horrible place, or the world is unsafe, I will never be happy, will result in the symptoms of depression like behavioral. And there are a lot of aspects of it, like behavioral, cognitive, physical. Like behavior is the behavior, like what you see outside. Like such a person may avoid the school and say that I'm not lovable, I don't have anyone in life, so I'm not going to school. And cognitively, thought process, they will be thinking that I am a useless person, no one likes me. Physically will be, I'll be tired, I won't feel like doing things. And emotionally, I will be sad, low, weepy. And motivationally, like I don't feel like doing anything in my life because I'm a useless person, people are leaving me. So these all are related, which I'm telling you, your past experience, your assumptions, your core beliefs, your critical incidents that happens in our life, everything get integrated and result in an activation of this automatic thoughts, which comes with emotions and result in depression or anxiety or any kind of illness. So then, this is one model, and we have this thing. It's very easy to understand, so I'm just keeping it there. It's called depression that we are talking about. This is a triad by Beck. They say that people with depression will have assumptions about the world, their future, and their own self. I'll just read it like, I am ugly, I am worthless, I am a failure. To the world, they may feel like no one loves me. The future, they will also feel that I am hopeless because things will always be this way. So when this all comes together, according to Beck, a person can have depressive symptoms. So, but in older adults, there might be other factors also, like not only older adults, everyone, but specific to older adults, there will be interpersonal issues and unexpected diagnosis, physical changes due to aging, uncertainty about the future, and what after me phenomena, like which is like who will take care of my spouse after me? What if something happens to me? And who will be there to take care of them? So, and the social interactions, etc. These all get integrated to this triad or this triangular relationship and result in the depressive symptoms. CBT also has an approach called behavioral activation, where when you are depressed, I think you can understand that when you feel low, I would say that this word, when you feel low, not depressed, you may not feel like doing things, right? When I'm feeling really low because imagine like there is something bad happened in my life and I'm thinking that every life will be like this forever, things are not good at my life, and I feel low or I don't feel like doing things, and I avoid the things which I used to enjoy before. Like imagine I was a person who used to read books or who used to listen to music, who used to go out with my friends for a coffee or something. So when I'm really sad, I feel like I'm not going with them. Life is really bad. I don't want to go with anyone. I may remain in my room and I won't go out. I don't talk to people. And what happens? I will feel low again. Then I will say that my life is like this. No one is coming to visit me, and I don't have anyone. My life is really horrible right now. Then again, I will remain in my room, not meeting anyone. So then the cycle of depression will continue. And we in CBT, we have a beautiful concept called behavioral activation, where we encourage the person to do the things that they used to love before. So we make them a chart and then we motivate them or we help them to navigate and find out the things that they love and how to execute it. So it will be like very basic things sometimes, just going and getting a coffee from a shop. And what happens when you accomplish a task, gradually you feel good. And then your emotions will improve. So this is called behavioral activation, which is a beautiful technique in CBT. I'm just going a little fast with other techniques that we have. We have relaxation techniques like diaphragmatic breathing, where we help the person to have a deep breathing with the diaphragmatic exercise, releasing and stressing of it. And that's end up in having a calm arousal reduction. So we also have progressive muscle relaxation, where we help the person to tighten their muscles, like from one order to another order in a hierarchical basis, and then we ask them to release it, and thus resulting in the arousal reduction, or the person will feel calm, relaxed, etc. There's a lot of benefits like decreasing in anxiety, stress, improving sleep quality, pain relief, and even improving in blood pressure also. So the major goal of CBT so far is like to bring awareness to your automatic thoughts, which are the thoughts in the background of your mind and resulting in your emotional arousals, or like, feeling low, feeling anxious, etc. And also help you to stand back and question these inaccurate, negative, automatic thoughts, to evaluate them, to correct them. And fundamentally, CBT is not an approach to teach positive thinking as a solution to life problems, because you would have heard that, like, a lot of people say that be positive, then they say don't worry, don't worry. So the thing is that CBT doesn't say that, like, having a positive thinking will enable a person to be completely well-being. It's basically understanding our own self, or our own thoughts, or our own feelings. It's basically understanding yourself and focusing on what you have right now, here and now, not on the past, not on the future, but what you have on the plate right now. And we also have cognitive restructuring, like structuring our thoughts with challenges given to it. I'm not explaining it, but in the discussion part, we'll try to do that. So in the nutshell, CBT is a structured psychotherapy, or we can call it in simple terms as a talk therapy, where we focus on the relationship on your thoughts, your feelings, and your actions or your behaviors. So this will help a person to identify and challenge their negative automatic thoughts, thus developing a healthy way of dealing with the stressful situation or their current situation. And we widely use this as a treatment method for a lot of mental health concerns. And these are the references that I have. And thank you. And I'll hand over the session to Deepthi, where she will be discussing on the application of CBT in older adults, and then we will take for discussions and queries. Thank you.
Thank you so much for a very insightful and a wonderful session, sir. And that was very well explained by you. And over to you, Ms. Deepthi, for your presentation. Thank you so much. Over to you, Deepthi, ma'am.
Yes. Just give me a minute. Yeah. Can you all hear me?
Yes, ma'am, you're audible.
Can you see the slides?
Yes.
Yeah, it's
Yes,
fine now.
it's visible. It's visible, ma'am.
Okay. So, good evening, everyone. Also, first of all, I wanted to thank Mrs. Amrita for a wonderful introduction. That was really generous of you. Yeah. So, my name is Deepthi, and today I'll be talking about the applicability of CBT with older adults. So, first and foremost thing I wanted to ask you all is psychotherapy, will it be useful? You all heard what Alwin was talking about. He spoke a lot about CBT. It is a form of psychotherapy. So I want to ask you all, is it important or will it be useful? Can anyone, I would like it if anyone will be able to answer it. You can
Can you
unmute
come
yourself.
again with your question, ma? Can you come again with your question?
With the question? Yeah. So my question is will psychotherapy be helpful for this particular population, for this particular age group, 60 plus people?
Yes, it will be useful.
Okay. Okay. How? Can you please tell me? Yes.
Because we have been able to talk to people
Mm-hmm.
make them to tell us their accident. And they can freely interact with people, and then the people where they can be understood. We have been able to do that. Therefore, it is definitely useful for the person who would like to talk, please.
Wonderful, sir. Wonderful. Yes.
If your approach should be
justified or judiciously question rises, because we one batch for senior citizens we did it, second batch people are not liking. I don't know why. I explained, whatever plus point is there, you take it. Negative points, you leave it. But still, second batch people are not coming forward to take up. G1 and other team, they did well. But to my knowledge, it was all right. But others did not like, because the way in which they are raising the question, doubting the integrity of the seniors, or doubting their genuineness, or doubting them itself. What is there asking, when we want relaxation, we want plus points of us, not the negative thinking and other thing. So your this thing is question was correct. So depends on how you are moving with the seniors is paramount important, rather than for their own research work or their own project work. If they raise the question, the seniors don't like it.
Right.
No, 1 minute. I just want to say that
Yes.
all, whether it is youngsters or old people, they are all thinking people, constantly experiencing, and due to interaction with daughters, grandchildren, son-in-law, daughter-in-law, so all sorts of children, and they will be experiencing so many things. I think by talking it out, it helps. It helps. And whatever you are going to say will be useful, I'm sure.
Right. Thank you everyone for all the responses. So I definitely agree with all your points, even with what Mr. Pachegowda has said, as well as everyone. You all are right. So let me come to my points now. So what we all understand, most of you all might be going through, during this age, right, during this period, is something called transition. Now, why did I use the word transition, right? So, for example, if you've seen a teenager, so the teenager common, difficulty is like, always appears confused and someone who is moving from childhood to adulthood. So that is a very common example of transition. And like this, throughout life, we go through changes, transitions, make adjustments, right? But the least talked about is the transition that happens in this particular age group, people who are moving towards 60s and who have moved forward after 60s, right? So the common transitions that could be happening could be, with respect to their roles, responsibilities. Earlier they were a caregiver, and now probably they are the ones who are taking care of themselves, or it could be the both, other way around. Children are moving away, they have to do their things by themselves. It could also be the fact that, previously you were working, you were a working professional. Now you are moving towards retirement, or some of you are retired. So, and to being very much engaged to, being engaged in multiple things, or not very less engaged as well. And also the routine also changes, and you might be experiencing you might be experiencing losses. It could be losing a friend, losing a family member, experiencing grief. And also some very concerning would be some physical health issues, sleep, like Alvin mentioned, and also changing structure in the family system. Like how earlier, like at least from what I have heard from my seniors, from all of you also, from the era when you were coming, it was more of a thing that the child would take care of the parents. And now with the coming changing generations, it's not the case. Parents have to take care of themselves, and children might provide support or not provide support. That's a different story again. So it is a time of transition, a lot of changes, and it is one place where a person can have hold risk for developing a mental health issue. So another aspect is mental health issues are quite masked in older adults, most often neglected. One thing is that stigma is still present. I might be feeling sad, and it could be pervasive. Like Alvin explained, how depression could look like, or anxiety could look like. But it might just be told that, it must be because of my old age. And sometimes anxiety looks like some other physical disorder. For example, gastric problem, but consistently you're having gastric problem, and then some pain is there everywhere in the body, and doctor is not giving me proper medical reason. And finally, we see people in the clinic coming saying, oh, they get a diagnosis of anxiety. So, but coming and seeking help, still the stigma is present. Another aspect is social support. It's one of the very important things, and I see that this is a very nice social group that we've gotten. But if we have observed that it often reduces with time, and one thing is through losses, another thing is family changes is there, and another thing reason could be physical illness as well as mental illness itself. And there's a bidirectional relationship between these two. If a person has a mental illness, a person can be isolated, and the other way, if the person is isolating themselves, there is a risk to develop mental illness like depression. So hence what? So now how can psychotherapy help here, right? So psychotherapy will be able to help us knowing ourselves much better. Like, how a person has been all this while, identify their strengths, limitations. So what are the current challenges now? And therapy can be the techniques or whatever the format of the therapy, what techniques Alvin must have explained right now. It can be customized according to the person's strengths, limitations, and how they can move forward with it. So more on how does therapy look like? So now today's topic was CBT, so cognitive behavioral therapy. Why should we do CBT? So one of the CBT is one of the most researched, very well researched therapies in the world, and it has evidences for like managing multiple mental health conditions, and it's also been seen that even physical diseases management, see, along with medications, it has helped a lot. So one thing we can comment, this common factor we can see is that in this particular age group, both mental health and a combo of physical disease can happen. So CBT is very flexible to be, we can customize it in a particular way based on one's issues. We can customize it in that way. A treatment can be done in that particular. One more important aspect is it focuses on the here and now part. It helps in keeping focus on the present. So now so we wouldn't want the person to keep dwelling on the past. But that doesn't mean that therapists won't be aware, won't try to understand where this person is coming from. They will. So we'll try to understand how the person has done in the past, how have they been, their strengths, assess all these things, and to understand the person we would, but then what now and how to move about it. So that's something this problem solving approach is something we take in CBT. So how does it look like with older adults? Right? Um, I know there's a diagram here. It might be a little overwhelming, and I've used some terminologies. I will explain it to you with a example. Like I'll give you a case example, basically. So Mr. A, he was 70 years old, and he used to live with his wife. Children are not there with him. And then he came up with complaints of pain in his head, throbbing pain, like like someone has taken out the nerves out of it and pushed it back, kind of pain. And that's how he described. Okay. And so he also said that he used to feel very scared about something would happen, something wrong will happen. And then he used to not go out of the house. Okay. And medical reasons, there was no medical reasons explained. Like, so they went to multiple doctors as well. So he used to not go and meet his friends, not go out all, and was very dependent on his wife. So now I told you an example case, right? So let us look into this diagram. So let me tell you. So what are the emotions he faced? He was scared, right? The feelings were very scared. And the physiological or bodily sensation was that he had this pain in his head. Then what was his thoughts? That something wrong will happen. And he was also scared that he will fall. And what were the behaviors? He used to not go, he used to just avoid going out itself because for the fear that something wrong will happen and he will fall. So this relationship, how if one increases or one decreases, the relationship between these four things was, helped to make the person was made to understand about this relationship between the emotions, actions, the body sensations, and the thoughts. Along with that, what was the environment doing, right? The environment is his family, so his wife. So it was that, she was thinking that, oh, my husband is not keeping well, so I have to support him, and she was taking the caregiver role, and which in another way it was maintaining his illness as well. So through therapy, we found this out. And cultural aspect. So his friends, even the society around him, oh, this person is sick. So they were creating that sick role for him. And due to which his anxiety kept increasing and it was maintained again. So it is all a circle. Each of these things are related to each other. So this is how we come about understanding what all reasons could be that this person has uh, developed this particular illness or developed these mental health problems. And based on how this person was brought up and how this person has come here, we discuss the treatment plan as well. So modifying either of these, the thoughts or the behaviors or the emotions or the physiological state, actually, we can turn it around. So that is what we do in therapy. There are multiple techniques for it, which I think Alvin has briefly covered about. So next, one more important thing we do in specific to this age group, 60 plus people, is that we in therapy, we also try to differentiate between what are age-related changes. See, like in that case A, the cultural thing was, oh, this is respect because of the age, he is like this, he must be ill. But that's not the case. Like he was actually undergoing a mental health issue, right? And differentiating them and also normalizing the fact that it is a time period of transitions, a lot of changes will happen, and also what kind of meaning he is making out of it based on these changes and what adjustments this person was making, and how these changes actually influence his physical and psychological well-being and how he was viewing his life mattered a lot, and that's what we looked at in therapy. And then we also address the cultural beliefs, like I told you, towards aging. So attitude towards aging. So now you might wonder whose attitude? Attitude of the person, the client itself, as well as the therapist. Therapists are trained, like Mr. Bachegowda, I think he told something very important. We don't respect, or this younger person does not want to listen, or something like that. Those kind of things might be there, and which might be true as well from the other person. So therapists are trained in such a way that they don't hold this bias. And how do we, I mean, how it is addressed in therapy is that someone asked me actually that how come you are less than half of my age, you have no experience in life, what are you going to help me with? So my answer to this, and how I've been trained to respond to this, is that, see, I might not have the experience, but then I am trained to use your experience to handle these problems. So more often than not, the answers lie within you, right? Another aspect is stigma. We also cater to try to understand from where this person is coming from, the cultural background, from where this, what are these beliefs are, and more often than not, we cannot always challenge them, but try to accept and also try to bring in some flexibility over there. Another thing, sorry, another point was optimal aging. So now, what is this term? Yeah. So, for example, this person had, Mr. A had fear of falling, right? But he's 70 plus years. Okay. And fear of falling he had, and he was not moving around because of that. He actually didn't have any mobility issues. But then If you look at it, he's 70 plus, and actually there is a risk for him if he actually falls down, something may happen. So what do we do here? What are his resources? So we can either ask a family member or the therapist itself. So we can have some activities around it, cater to the needs basically, and making sure that what resources are there and also meeting the goals. So that is optimal aging. Then one more aspect of this particular CBT with this group is that making use of life experiences and narratives of resilience. So what does this mean? And I see you see this picture of this timeline. So I'm going to explain that. So from your start of your life till now, they might have had like many events that would have taken place. So we will try to jot down what are these major life events that were super challenging, super difficult, and how did you overcome it, right? And what is the challenge right now? Why is it so difficult right now? So thus bringing in the values or the wisdom itself from this particular experiences, right? And how did this person overcome? So that is an example of resilience. So how did this person come back at it? So we identify this person's strengths as well as due to particular reasons, the shortcomings, as well as how can we move forward with it. So this is what we try to do in CBT. So what do the targets look like? So in a session, in a typical sitting of we would have like around 8 to 10 sessions, and the targets. So I wanted to tell you one thing. People usually come to us for symptomatic relief, but then more often than not, when they come to us with symptoms, when we start exploring, we realize that there's so many other life issues. It could be interpersonal issues, or something within themselves, or it could be like cognitive problems, or it could be anything of that sort, something as basic as not being able to manage the routine. So these itself become the targets of therapy. So now what do we have? Like this is an example how it could look like. So one see targets could look like maintaining routine, increasing one's activity, managing anxiety, improving mood, sleep, dealing with losses, family issues, problem solving, building resilience. So these are some of the aspects that we looked at of CBT. And Alwin told a lot of techniques, right? So these will be inculcated with what I've so far explained. Like how would it look like with older adults? It was just a very short glimpse, right? So I just told you about this. So at least 8 to 12 sessions is recommended. Yeah. Okay, which brings me to the end of the presentation.
Thank you so much for a wonderful, very insightful and interesting presentation, Deepthi ma'am. And we have a few questions for Alwin sir here. Can I read them out?
Yeah, please.
How to overcome from the issues shown in the picture. There was some picture that he was referring to from the PPT, I think. How to overcome from the issues shown in the picture. That is one. And please cover some tips for happiness.
Okay, sure. So I think okay. So talking about the issues in the overcoming the issues in the picture, I think you might be indicating to the first slide which I had shown, where there were like depression, anxieties, and everything. So what I want to tell you is that everyone will have their own level of anxiety and worry and sadness and everything. But when they cross the limit, then they require a professional help. Professional help means that people who are trained to handle mental health concerns of older adults. So it can be clinical psychologists, counseling psychologists, psychiatrists, social workers, a psychiatric nurse. So those are mental health professional team can enable in the well-being. So depending on the concern, like I can't generalize, I can say I can't give a common blanket and say that okay, this is the remedy for this particular solution. And because I understand everything in the lens of intersectionality, which basically says that you might have different aspects of your life, your identities, or your socio-political, socio-economic identities, which will interfere in
But I
your
will not say don't do
psychological.
your seminar with some chairpersons have said that student has
Hello.
not met me, so don't do
Excuse-
seminar. It's not in anybody's interest.
Excuse me, ma'am. I think mic is on.
I'll just mute
can
them,
I-
sir. Excuse me.
Yeah,
1
sure.
minute,
Thank
please.
you. Yeah.
Just give me a minute.
Excuse me.
Yeah.
I think
Hi.
I'll.
I would like to answer her question.
Yeah. Sure.
What I do when I am in trouble or when I am mentally down,
Yeah, please. Yeah.
I go to the mirror and talk. I'll talk to
yeah.
myself. How many problems I have seen in this life, Jaya? This is not the first
Exactly.
time. So,
Exactly.
and every day is not a Sunday. If Sunday is there, Monday will.
Definitely. Yeah. That's called, that's a wisdom. Yeah. I think Jay, you are mute. Can you unmute and speak? Yeah, Jay, you are mute. Can you unmute and speak?
I'll
Yeah,
talk to
please.
myself towards the mirror.
Yeah.
I'll tell the mirror,
Mm-hmm.
and every day is not a Sunday.
Exactly.
I am 75 now. What
Oh,
all
yeah.
the problems you have seen in your life?
Yeah. The
Nothing is
wisdom.
permanent.
Exactly.
Be bold, get up. I will talk to
Mhm.
myself like that. Outside things cannot make you happy unless you are happy from yourself.
Within yourself. Mhm.
That's what my idea is. Even when I eat something, I may be happy. That is for a few seconds. When you appreciate me, I may be happy. That is also again for a few minutes. Unless I am having a happy nature, I have to think myself, I will be happy. What these things are not permanent. I have to think like that. We must not cheat anybody. We must not hurt anybody. If I hurt you, that pains me more. My heart will be going on telling unnecessarily you made Rajaram to feel sorry. That's what I think myself. Like that, I come out of my problems. I feel happy. All this time there was no power. Just now the power came. I came.
Oh,
I was not there for
okay.
first half an hour. What you spoke, I didn't hear. When Deepthi was
Okay.
talking, I came in between. That is my policy, sir.
Okay, that's
Instead of
nice.
hurting somebody, we must be happy ourselves. Think this problem will not continue, and happiness also will not continue. Both the things, you will
Exactly.
see the change.
Yeah, the
That's what
flexibility in
my
life.
idea is. Go and talk to somebody. Go and talk to some children. Automatically, without your knowledge, you will get up. Every day I was going for walking 1 hour. Because of the rain, I am unable to go.
Yeah.
No other way. This is a situation. When my son was 12 years, he used to tell me, accept the situation as it is. Accept the people as they are. That's what my son used to tell me. How true it is. When it's raining, can I stop the rain?
No.
Definitely
Yeah.
no. When my mother-in-law was like that, she was like that. My servant is like this. I have to adjust and manage. That's what the lesson I learned from my life. I will go and talk to my mirror. That's what, these are the problems I am facing. What to do, Jaya? I will ask the mirror. It will tell me what all you have seen in your life. This is nothing, it will tell.
Yeah.
Like that only I come out of my problems. That's what the answer for the lady who asked you this question, I don't know. How to be happy, she was asking. I want to tell her this. Ask her to try this. What is her name? I would like to know. Who spoke to you now? Somebody was asking how to be happy. I could see her face. I don't know her name. I want to tell her that.
I would
Be happy yourself. Don't expect. Don't beg for happiness from others.
I think it was from Mr. Tangaraju, ma'am. Thank you so much.
Yeah.
Thank you.
That's
Thank
all.
you so much for those useful tips, and
Yes.
it will be very
Thank you
useful.
so much.
Thank you.
Somebody is there to appreciate me also.
Yeah, that's nice. Yeah.
This is
really well. Yeah.
I got my answer from Mrs. Jayalakshmi or Vijay.
Jayalakshmi.
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 Wonderful, ma'am. Wonderful.
Thank
Yeah,
Really
really
gave a
nice.
Deepthi.
great.
Everybody is expecting more from their children or grandchildren or friends and relatives. The more expectation are main reason for the distress and unhappiness.
The expectation is the bad thing in our big
We have
in
to,
our life.
we have to adjust with the people.
Yes.
We have to adjust with the people, and interested people can gather in a place and feel freely and happily. Ego is the first enemy for unhappiness. Thank you.
One is expecting from others. Second one, going on telling all our problems to others. One or the other day, it will rebound. They will make fun of us. Don't express any of your pain to anybody. That is my life.
Okay.
Any
Okay.
happiness you
Thank
can
you so
share.
much, ma'am.
Thank you, ma'am.
Thank you.
Alvin, sir, do you wish to say something?
Yeah,
We have to see the poorer people, and we have to be satisfied with our status.
Thank you, sir. That's a very interesting point all of you have made. Like, you talked about how you have to look back in your life and, talk and figure out. So that's one of the techniques that we actually use. So for someone who is not able to see this, for someone who might have difficulty in actually taking help or actually doing it by themselves, that means somebody they might be facing some mental health issue or some problem. There might be something that is stopping them. And for that, professional help, like me and Alvin, could actually help. So
Dr.
that was
Deepthi,
one of
can I
the.
ask can I make a remark
Yes,
here? Yeah,
yes,
just
yes.
as you were giving an example that fear of falling when you go out. I have that. Like
Mm-hmm.
every time I get ready, and then if I have to go alone for a walk, I'll
Mm-hmm.
just think, what if I
Mm-hmm.
fall down? And many a time I
Mm-hmm.
cancel my walk. Because what
Mm-hmm.
if nobody is there to pick me? And I know it
Right.
is uncalled for fear, but it is there. I am 68, 69 years old.
Mm-hmm.
And me and my husband are there. My children are not here.
Mm-hmm.
So he won't be accompanying. Nobody will be accompanying me because you just have to go alone for a walk. And this fear, hinders me from going for a walk. But I know nothing will happen. You have a good, you can wear a proper dress. Everything is fine. But still that feeling is there. How to get over that?
Mentally, you have to come out, madam. Mentally, you have to come out.
Yeah,
Nothing
mentally
will
we should
happen. God is there.
see what
You believe in God.
Dr. Deepthi says.
No,
Yeah.
trust somebody.
Yeah, I will
Right.
talk to Deepthi. Yeah.
Madam, when you cannot move for the various reasons of fallness, fear, or weather, etc., you take up one yoga classes online, maybe build or any yoga this thing. That is a small 1 hour activity that
Yes.
will boost up your strength. 100% it will help.
You
No,
are
I
very
go for
Thank you.
I do go for a walk in the morning for about 2.5 kilometers every day morning. But in the evening, when I want to go out alone, I have this feeling.
Right.
No, even I don't
Can
go
I
out, madam.
answer?
Even
Can
in my
I?
case,
Yeah, please do.
I am
Please.
scared of these vehicles and lightings and halla balla. Everything is there. I am scared. In the morning, I go for a walk 1 hour and bring vegetables, whatever the things I require for the day. Both my kids are abroad. Last week only I came from US. I was not there here for 5-6 months. Recently I came back. Even now I have the jet lag. Now I feel like getting up. Night I don't get sleep.
Right, ma'am.
Yeah,
So,
thank you, ma'am.
to answer Yamuna, right? So,
Yeah.
can I answer, sir?
Yeah, please go ahead.
Yeah. So one thing is, yes, so there is some sort of fear that is there that you might fall down, right? Something unexplainable that you said.
Yeah.
So to what extent is it, disturbing your life in the sense your daily routine? is so if you're okay to answer that, it's okay. Otherwise, I would like to explain. So if this hinders this person's life in the sense like not being able to do their daily activities, and you're constantly worried about it, or and in a lot of ways it's disturbing you, then it would be called as a possible mental health issue. But if this fear is there in general, we have also seen that in this population, that fear of something unknown, like especially fear of falling, is quite common that we have observed. And we're trying to understand why is it. And still, I myself have no answer to it. But then it's a result of anxiety. That's what we have understood from research.
Madam, it is not just anxiety alone. It is also lack of services available. Supposing they don't have children to take care of them. If something happens, naturally they are worried what will happen tomorrow.
Exactly.
We cannot blame them. It is
Exactly.
a fact. We don't have buddy service. We don't have 911 in India. These are normal fears.
Yeah.
Please, we need to address that aspect also. I think the professionals just should not only think of counseling, therapy. You must be in touch with the reality of our country.
Yes.
Yeah,
If somebody is isolated and
I would
What
like
you
to.
say is correct, ma'am. We
I
will
got
always think about what if something happens, who will take care of me? And that is there. So it is safe to stay at home.
Yes,
And I go for a walk because my husband is accompanying. Both of us are going
To bring in project.
no, she's going in the morning for a walk. She's
They
taking
with
care
my
of her.
husband. Together we
Yeah,
go.
that's okay. At
Yeah.
night and the evening, it is okay if you're cautious, no issues. Just strengthen your muscles by doing yoga or whatever is possible.
Madam,
ma'am,
now police department to some extent helping here and there for senior citizens when they are alone. You can provide a list to the nearest police station that I am staying alone. So they monthly they come and they will get you groceries or they will get you medicine and whatever you feel asking what is in their this thing they will provide you. But alone seniors now so government has taken some initiative and they will be attending you every month or even a bit early also if on based requirement basis. Thank you.
This is in Bangalore or Chennai, sir?
Yeah, it is in Bangalore.
Okay,
No,
but not
I
in
am
other
not
parts of the
staying
country.
we are not in Bangalore. Sorry.
What about other parts of the country?
No, I want to tell you one
No,
more
you can you can try with your police station also. Even central number is there. I think 1090 or something.
But it is very nice that you mentioned that about the police department. How good do you feel about police coming to your house? I don't feel good.
No, not police, not police. They come with a civil dress and they will help you because we were called by the city police commissioner and helped us how to particularly this cyber crime and seniors staying. They will try to help. There is a provision is there. I don't know execution exactly. We are yet to see the result, but there is a provision in Karnataka.
We are not in a
like
position
to
to believe
answer.
anybody in this life
Hi.
now. When we people are alone, I am saying
Ma'am,
alone. I
ma'am,
can't believe anybody comes and gives. If he says I am from police, he can bring a fake certificate.
Jayalakshmi ma'am, can we just listen to actually
yoga
what
every
Mr.
day.
Alwin has to say? Jayalakshmi ma'am, I'm requesting you to actually listen to what Alwin sir has to say. Alwin sir?
Hi. I appreciate everyone's knowledge and understanding about what's happening around us, and that's a really good thing. So that's what we all say is always that mental health is not just what's written in textbooks, or it's not just therapy. It's a socio-political aspect, like the society that you're living in, the political scenario of the society, the where you're coming from. This all determines your mental health and mental well-being. So we are not. When we look in, just saying that it might be anxiety and everything, it might feel like, okay, is it the person is getting blamed, or person is the problem? So we always say that the person is not the problem is the problem. Like, we need to give credit to the problem, not to the individual, because individual comes with a lot of other as Jayalakshmi ma'am was also saying, about lot of wisdom, lot of encouragements and everything. So at the same time, we strongly agree that in India currently we significantly lack a lot of social securities. So as you mentioned, we don't have 9 months, honestly. Like, we don't have an immediate social security that can be provided to all the citizens in India. And people come from different strata of society, and the services that they exercise also depends on the socioeconomic status. So I don't think we can generalize mental health or any services to everyone the same. So that's why we say that in our project also we say therapy has to be customized. It's a person coming to the therapy, not the technique or strategies. So if someone comes with anxiety, we can't just give relaxation and send them off. And that's not therapy. Therapy discusses socio-political scenarios and find the problem-solving strategies also. What are the resources that can be facilitated for them, or what are the other options that can be available for them? So that brings their holistic well-being. So I want to make it very clear that therapy is not just talking about the problem, or not just that saying that, okay, if you have anxiety, do relaxation, you will be fine. It's not prescriptions. It doesn't work in the prescription way. It's more of a dynamic relationship and working on their other socio-political aspects and helping them to cope up with it. And there are some situations where we have no access to change. So as you said that, in one therapy room, we cannot change the societal structures and systems, but we can bring ourselves changes in some other aspects, but we can't change the whole system in a one therapy session. Definitely, we acknowledge that. But we can help them to facilitate the resources, or help them to understand what are the other options and possibilities available around. And that's why we say mental health is socio-politically oriented. It's not just a relaxation technique. It's not just the talking that the therapist and the client have. It's not something that is listed in the diagnostic manuals. And therapy cannot be just prescriptions also. So I thought if I want to make it very clear with that. Yeah.
At last, I just want to add one thing. Like from the NIMHANS, we are from the yoga side, we are conducting the yoga daily, Monday to Friday, 6:50 to 7:50. Apart from the holidays, it will be there. So anyone interested, you can join the yoga early morning. So it will be good for your mental health as well.
Can you please send the link through this that we can just join?
Actually, Nightingale is doing, myself, Manjunath, we all are attending that, madam.
It is good
that
that
is
you are
Tuesday,
doing,
Thursday, and Saturday. We people are attending.
I have put the NIMHANS Zoom ID and password for online general yoga. If you are interested, you can save that and you can follow further.
Kindly send a link in this WhatsApp.
Madam, I have put the online ID and the password, so you can save that from the inbox.
Hi, before we winding up, I would like
from
to...
your phone, you can take a photo of that address, what she is giving.
Yeah, we are. I just wanted to speak a little bit about the research that's happening in NIMHANS as well for older adults. I think, okay. So we are running an ICMR, which is Indian Council of Medical Research, which is a body in India, government body that help to provide researchers for different populations. So right now they are focusing on older adults. So this research is basically for people who have common mental disorders who are above 55 as well. So common mental health disorders include depression, anxiety, sleep issues, somatic pains, etc. So what we do is that we provide them with therapy and other support as well. But here there is one thing that we need to keep in mind, that when a person approaches us for therapy, if they go into the place where they receive talk therapy, which we had the whole conversation about, so there is a two chances. One chance is that they may go to the group where we have a CBT, which we had a discussion on. For them, it will be every weekly, there will be sessions ongoing. And for people who belong to the other category, we will be doing psychoeducation session and we will do regular follow-up with them. So we are just trying to understand how this transdiagnostic CBT can be effective for older adults. So we can make a manual after that and then release it for the public. So later in future time, people who are older adults can benefit with that treatment. So if anyone who feels that they have depression, anxiety, and willing to be part of this research, which has a very good social cause, I would say, because in future, if you want to make a model like this, and this will be benefit for many people in India. So this will be released from NIMHANS and a lot of people will benefit from it. So if you want to be a part of this research and this attempt, please reach out to the contact numbers and details which is provided here. You can come to NIMHANS. Therapy will be completely free, and we also be checking on your other parameters like your lipid profile and your diabetic profile, etc., for your holistic well-being as well. So we are trying to understand whether the therapy can have an impact on that as well. So this research has a significant social cause. So if you all feel like to be part of it, if you feel that you also have a common mental disorders and you want to get it acknowledged and addressed and to be part of this research, please reach out to the phone numbers which you have provided. And also you can email to this email ID as well. So we will get back to you and you can be happily a part of this research as well.
Is it, by the way, is it possible for you also to provide the same type of support system to the senior citizens as a model that has been started by Tata? You know, a young person coming and talking to the, giving companionship to the senior citizen. Is there something existing in down south?
NIMHANS, yeah,
Buddies,
buddy system, yeah.
Yeah.
Currently in NIMHANS, we don't have an active buddy system existing, but that's a good idea, and we can think about that seriously. In the project, we have a couple of modules for facilitating social supports, and we are including family members in the therapy process. So that we can give more psychoeducation to the family members, reduce the criticality towards older adults. So it's our intervention is also focusing on the family as a system as well. So that is our focus. The individual and the family becomes a focus. But as you said, it's a very good point about like providing another extra social support networks, which we will think about throughout the process of the therapy regarding the concerns that people in the therapy report to us. We'll make a report and then we'll see what can be done.
Thank you, sir, for that information. Yeah. And if there are no further questions, with your kind permission and Deepthi ma'am's permission, may I conclude today's session?
Yeah, please. Yeah,
thank you so much. On behalf of the Vayomanasa Sanjeevani NIMHANS team, I would like to extend my heartfelt gratitude to each one of you for joining us today for this insightful and engaging webinar. Firstly, I would like to express my sincere appreciation to all the esteemed speakers for sharing their expertise, knowledge, and valuable insights with us. Your contributions have truly enriched this webinar and provided our audience with valuable information. A special thanks to all the participants for your active participation, thoughtful questions, and contributions to the discussions. Your engagement has made this webinar a dynamic and interactive experience for everyone involved. We would also like to acknowledge the hard work and dedication of the organizing team behind the scenes. Your meticulous planning and execution has played a significant role in the smooth running of this webinar. Last but not the least, I would like to express my gratitude to all the audience for your time, attention, and enthusiasm throughout this webinar. Your presence has made this event truly meaningful and impactful. As we conclude this webinar, let us take forward the knowledge and insights gained today into our respective endeavors and continue to strive for excellence in our respective fields. Thank you all once again for everyone involved, and we look forward to your continued support in future endeavors. And have a wonderful evening, each one of you. And thank you, everyone.
Thank you,
ma'am.
Thank you, Raja. Have a great future.
Thank you, everyone.
Thank you, madam.
May God
Thank you,
bless you.
everybody.
Jambana sir. Jambana sir, thank you.
May God bless
Jambana
you.
sir, thank you.